Hello, this is Dr. Eric Bricker from AHealthcareZ, and this is the How to Sell in Healthcare podcast. Today's episode is how to sell during the COVID pandemic. Now, of course, none of us have ever sold in a pandemic before. I have never sold in a pandemic before. So how in the world are we going to take our previous sales experience and apply that to the current sales environment of the pandemic? And here's how. I don't know how to sell in a pandemic, but I do know how to sell remotely. And if there is anything that has changed the dynamic of sales during coronavirus, it is that business-to-business sales, complex business-to-business sales, has become remote sales. It has become telephonic sales. The in-person component of sales has been taken away largely. Okay. What does that mean? There are some profound implications of this. And I had a ton of telephonic B2B sales experience in employee benefits at Compass because I had 3 young children and a spouse in a city where we had no extended family. So we didn't really have the sort of structure set up for me to travel a lot. Plus, we didn't have any money at Compass, so we didn't have a lot of the budget for me to travel either. So I ended up doing a ton of stuff telephonically, and I was able to make it successful. I sold groups up to 3,000. I know for a fact I sold groups up to 3,000 employee lives telephonically. I even did a group of 6,000 telephonically. I would say 6,000 employee lives was probably the largest group that I sold completely telephonically with no in-person interaction whatsoever. No visit in person to them, no them doing an in-person visit to us, nada. So with that being said, what can one do telephonically, and how does one need to approach sales differently in a complex sale that is telephonic? Okay, so we're going to go through that now. So number one is, as you can imagine, while I did have a couple of large group sales, some large group sales, I would say that the size group was generally small. Now, so for those folks that are only doing solutions that are available to self-funded employers, you can still do solutions for self-funded employers, but it's going to be self-funded employers like mostly 200 to 2,000. I believe you can sell a lot of self-funded groups 200 to 2,000 in the self-funded space, and you can certainly sell a ton. In fact, I would tell you the majority of my fully insured groups I sold telephonically. I did not sell in person. And so there's a ton of groups under 200 that are typically fully insured that you can sell telephonically as well. Zoom, yada, yada, yada. Okay, so fine. So the size of the group is one thing. So going after, like if your prospects are like 10,000 employees plus, I'm not sure you can pull that off telephonically. But if they're sub 10,000 and certainly sub 3,000, even sub 6,000, I think you can do it. Okay. Number two, what does that mean? That means you've got to be really good on the phone. Okay. What does being good on the phone mean? Okay. Number one, it means you can speak extemporaneously. That it's not just presentation, because you're not always going to sit there doing slide decks. It's a lot of just calls. It's a lot of just talking to people. And actually, this is the way that it used to be. Before email, people used to do a ton of just, in the business world, people just talk on the phone all the time. I mean, my dad was a businessman before, and he had a cell phone in his car in like the late 1980s. He had one of those massive in-car, it wasn't even called a cell phone, it was called a car phone. And you just talked on the phone all the time. My dad was constantly talking on the phone. That's what you did. So it's not a foreign concept. Back before the internet, you could sell stuff over the phone. And getting on a plane used to be, before the 1980s, getting on a plane used to be super expensive. So you can definitely sell things over the phone. It is possible to build a rapport over the phone. And that's really the key, is that you have to learn a way to build a rapport and to build a relationship over the phone, because the reason for that is because the relationships establish trust. And in order to sell, you have to establish trust. Okay. What is the root of trust in that relationship? It is character and competency. And that's a Stephen Covey definition. that trust is based upon two things. It's based upon character and competency. Okay, character is about following through on micro promises that you make. So someone asks you to provide an example utilization report, you provide it that day. Somebody asks you to call them back on a certain day, you do it. You set up a webinar or a conference call, etc. You always show up for it no matter what. So the way that you establish trust with a capital T is to establish trust with a small t in little things repeatedly over time. So you want to have a lot, and it's not, and the best way to establish trust is in that, and the best way to establish a relationship, by the way, is in a one-on-one fashion. So it's not just it's very hard to establish trust with a quote-unquote group of people on the other end of the phone, conference call, webinar, and you think, oh, I'm touching so many people, I'm able to kill 10 birds with one stone. But from a rapport standpoint, you are not. Yes, you are communicating information, but you are not establishing trust and a relationship with those people. You really got to do that one-on-one. Okay, so that's one. Is that it has to be a lot of phone calls, and it has to be repeated, and you have to be, follow through. You have to be honest. You have to be truthful in everything that you say. When I was working as a physician and doing sales at the same time, I had a patient who was a longtime retired salesman. He was in sales for like 50 years. And I said, do you have any sales advice for me? And he said, yeah, don't lie. That was the number one thing that he said was the most important thing. And I will tell you that is absolutely true, in my opinion. So, and then the next thing is competence, okay? And I feel like this is really hard because you got to do your homework, and it's like championships are won in the preseason. So you have to be really competent. You have to be able to talk shop better than the other people on the phone. And especially if you're younger in your career, you don't have the experience that they do. So what does that mean? That means that you need to read as much as you possibly can. Okay, there are a variety of sources where you can get this information. I think that the Axios Healthcare Daily Newsletter is very good. I think Kaiser Family Foundation is good. You read Health Affairs, which is the major healthcare policy journal. You read Becker's Hospital Review. You read Modern Healthcare. Modern Healthcare you need a subscription for, but it's not a lot. You read the Wall Street Journal. You read the New York Times. You read ProPublica. Now, Warren Buffett reads 7 newspapers every day, and he spends about 6 hours every day just reading, and he can speed read. So his 6 hours of reading is like probably the equivalent of like 12 hours of somebody else reading. So you have got to. Now, it is very much preseason, hitting the gym, doing training sort of stuff. It's not glamorous. It's something that accumulates very slowly over time. So just like going to the gym, you want results immediately. You want competence immediately. You can't get competence immediately. It has to be built slowly over time. But you have to be totally in the know so that you can always be bringing value. Whenever you have these conversations, you're constantly bringing value. Like, hey, it's always like, hey, did you see, such and such article? And if it's like, no, they're like, oh, let me tell you about it real quick. Or if it's yes, it's like, hey, what'd you think about that? Oh, that's really interesting. Let me tell you a couple of thoughts that I had about it. And those sort of being able to talk shop, not directly about your solution, but just about the industry, is incredibly valuable in terms of building a rapport, because you want to build a relationship with these people. And I will tell you, of course, I had an advantage in being a medical doctor because I had 4 years of medical school and 3 years of residency, and then being in private practice where I had, I don't know what that, I can't keep track, it was like 12 years, I don't even remember how many years it was, of all this exposure to what was driving claims costs, that I could always add value to their perspective as an employee benefits professional. And I'd be like, look, this is how discharges really work, and this is what really drives readmissions. Or, what really drives elective surgery costs. Let me tell you what drives elective surgery costs. It's not surgery centers, it's hospital-based outpatient surgery. Oh, did you know the majority of hospital surgeries are actually outpatient surgeries? Hospitals are essentially very large ambulatory surgery centers. Vast majority of surgeries there are not inpatient surgeries. So, and that's just the tip of the iceberg. So you can't be competent overnight, and it just has to, and I've said this in a prior podcast, is you have to just listen and watch my AHealthcareZ videos. I mean, that's just why I'm creating it, is so that every day you can have something to educate yourself a little bit more. But that's not enough. If you watch my AHealthcareZ videos and you think that's enough to gain competence, it is not. What I do at AHealthcareZ is not sufficient for you. You have to do New York Times, Wall Street Journal, Modern Healthcare, Axios newsletter. The Gist Healthcare email newsletter is also very good. Subscribe to Health Affairs. So it requires a ton of reading. It also requires the videos on YouTube. Like, just pick any sort of esoteric topic in. Drugchannels.net is excellent. 36 Brooklyn is excellent, both in the pharmaceutical world. Both of those are excellent. So all of these resources, like I said, there is not a wasted minute of the day when you are developing your competency. Okay, so you're going to have these frequent phone interactions, and you're going to have this competency that you develop over time, and then you also need to then have what is referred to as a transfer of trust. In other words, people that the broker consultant or that the HR person, the people that they know are also some people that you know, and so that person can essentially vouch for you. It's sort of like a reference, okay? But it's not going to be sort of a full sort of reference call. Like, they're not going to necessarily like call, let's say you know Joe and the person you're talking to knows Joe. It's not like the person is going to call up Joe and be like, hey, is Eric trustworthy? That's not what they're going to do. I mean, people are so busy that they're not going to do that. But here's what you do. What you want to do is you want to breed familiarity. And the way that you do that is by talking about mutual people that you know. What does that mean? That means you have to be good with names. Okay? So people are always like, oh, I'm terrible with names. Listen, I'm terrible with names too. But it's just like tennis. You have to practice. I had to practice with names. You have to get good at names, okay? And you have to get good about things about those people. So where they work now, where they used to work, if they did, if they spoke at a conference, or if they wrote an op-ed, and what you're going to do is you're going to look at, on LinkedIn, you're going to look at your mutual connections. Before you talk to anybody, you're going to go on LinkedIn and you're going to look at your mutual connections. And you're going to see who you have in common so that you can just name drop people. And you don't make a huge deal of it out of the beginning, but you sprinkle it throughout the conversation. And you make, small anecdotal, make small anecdotal comments, like, we both know so-and-so in Cleveland. And it's like, Cleveland's the most interesting place in the world because the people will drive in from the suburbs with 2 feet of snow on their car, and the people in the city only got a dusting. And it's because the northeastern part of the city gets more lake effect snow than other parts. And it's like, oh yeah, that's totally true. It's like crazy how much, that part of the suburbs gets the snow, and in these other places it gets like nothing. Or you talk about the Greyhound bus station or Jacobs Field or whatever, right? So it's tying the person that you both mutually know with some other things that you mutually know, and that's kind of small talk or chit chat around shared acquaintances or shared people that you know. And I am not good at it. It requires skill, and it requires practice, like tennis. It requires practice to develop that skill. And of course, the only way you're going to acquire all of this information about people is if you are interested in people. So you have to have a genuine interest in people. And people always say, okay, are salespeople born or are they made? This is an aspect of salespeople, in my opinion, that is born. And what is born is a genuine interest in other people. Now, I'm sure many of you have run into essentially sort of self-centered salespeople. And at the end of the day, anybody who's self-centered is kind of more interested in themselves than in other people. And so they really don't have the ability to learn other people's names and really know a lot about, details about other people, because they're just not really interested in other people because they're interested in themselves. So this is where you have a leg up on those more. Nobody's perfect. I mean, everybody has a self-centered side and an interested in other people's side. It's on a spectrum. It's not binary. It's not a 1 or a 0, myself included. But this is where if you take a sincere interest in other people, it will help you in your ability to remember things about them and be able to recall them at a moment's notice when you are extemporaneously speaking with people. And that is the other area about the conversations that you're going to have on the phone with these people, is that you're going to be able to speak extemporaneously with them. And I'm incredibly socially awkward. I was horrible at small talk. I hated it, and I was horrible at it. And it all through my teenage years and even into college, even in medical school. And I just had to, it was really in residency, because you had to chit chat with the patients and you had to chit chat with the nurses to develop a relationship in order to be able to get anything done in the hospital. Like, if you don't have good relationships with the nurses, you will never get anything done at the hospital. And my work experience at Stockham helped me out a lot with that too. And so if you're not good at it, like, you can get better. And the way that you get better, again, it's like tennis, it's with practice. And the only way to get better at because small talk is much more genuine. Or I shouldn't say small talk. Speaking extemporaneously is much more genuine. People in the business world like to use the word authentic. Okay, it's not a sales presentation or pitch. You're just talking shop. You're speaking extemporaneously, and one's ability to speak extemporaneously is hugely important. I would argue that the ability to speak extemporaneously is, are salespeople born or made? I think this is something that you can make in a salesperson. So I think you have to have the inborn interest in other people, but I think you have, I think that comes from your mother and your parents probably. But the ability to speak extemporaneously absolutely can be learned, and it's learned with tons of practice. And that's where I love selling to small and medium-sized groups, because there was just a ton of groups and there was a ton of at-bats. And so I had a ton of meetings in the first year, or I should say 2 years, that went horribly. My ability to do the small talk and build rapport was really bad. And I would even have brokers give me feedback about it, which, at the time my ego was like, but in retrospect, it was actually very kind of them to take the time to be like, look, the way that you handled that was not necessarily what I would have liked. Oh no, what have I done? So, and so to be, and I guess the other piece is, the other part of being a quote unquote salesperson that is born and not made is then the self-awareness. So if you can have the genuine interest in other people and the self-awareness to be like, okay, I messed that up, let me learn from it, as opposed to, well, no, they're just idiots, I'm going to keep doing what I'm doing, then I think that if you have those, you don't need a ton of innate, I should say, characteristics. You don't have a ton of those, but but those are a couple big ones that I think are very important. Now, the other thing, now this is a little bit of a controversial subject, and I'm going to probably get into a little bit of trouble here, but one of the key, and actually Malcolm Gladwell talks about this in his book, The Tipping Point, when he talks about the salesman as a way to develop a tipping point. And salesmen do cause things to tip. And he says that the way that salesmen tip is through their nonverbal communication. And so nonverbal communication obviously is much harder to do over the phone than it is in person. And what is the nonverbal communication that is most frequently used by salespeople? It is, it's two things. It's either the alpha male, right? What are most salespeople? They're men and they're tall. And it gets to the native, caveman, limbic system parts of our brain where we just want to quote unquote trust a leader. And our limbic brains, which are the very old central parts of our brain left over from the Neanderthal days, trusts the tall, large men because they were the alpha males of the tribe coming out of the cave who are going to protect us from the saber-toothed tigers. So what are all salespeople? They're all tall, okay? I am not tall. I am 5'8". Okay, I will tell you in the same breath that the most successful salesperson that I have ever met in employee benefits is shorter than I am. He's like 5'7". Okay, so there's no way that you have to be tall in order to be successful. But a lot of salespeople are tall, and that height and that size is that as an advantage for them is highly diminished now in coronavirus because they have to do it over the phone and they can't do it in person anymore. So they don't have that height advantage anymore. So I can't say that this is true all of the time, and many of you listening to this might beg to differ with it. But I just have seen this so much. I mean, I talked to the not the vice president, above the vice president. He's like the head of the employee benefits section of 1,000-person brokerage, which is not huge, but it's not small, okay? And he's 6'2", and he says that when they have their sales meetings, their sales conferences together every year, he is the shortest person in the room, okay? So you get the idea. So the point is that if you are tall, that, I don't know. I don't think tall people are like, I'm just going to intimidate my way into sales with my tallness. Like, I don't think it works that way. I mean, it's a subconscious thing that works to their advantage, and they've used it. I mean, and that's fine. There's nothing wrong with that. But it just means that if you were successful before in part because you were tall, you just don't have that anymore as an advantage. And so you need to have the advantage of the establishing trust through competence and character and being able to speak extemporaneously and doing your homework on subject matters, et cetera, et cetera. So just, if anything, it does to a certain extent level the playing field. Okay, so now what does this mean now that we've said that it is largely going to be sales for groups sub 3,000 to 6,000? What does that mean? That means in order to meet your sales quota, almost by definition, you are going to have more smaller sales. In other words, if your average group size was 2,000 because you had groups that were above 2,000 and groups below 2,000, well, now your average size group might be only 1,000 or 750 because those large groups don't pull your average group size up, which means that if you're going to meet your quota, you have to have more of these mid-market and small groups in order to meet your quota. Okay, so what does that mean? That means that in a telephonic sales world, prospecting becomes that much more important. That means you have to have an even larger top of your funnel. And that totally works. That should not be demoralizing, because I look at it as an advantage and as an opportunity, because prospecting is so hard and most companies do it so poorly that if you can actually do it well, then that is going to tremendously separate you from the other salespeople and the other competition. So just know that this is a solvable problem. Like, this is, like, in my opinion, hitting your quota is not impossible in a COVID pandemic world. It just means you're going to have to do things a little differently, as I have described in today's episode. And so with that, I will bring the How to Sell in Healthcare episode to a close for today. Again, this is Dr. Eric Bricker with AHealthcareZ. Thank you so much for being with me, and I wish you the best of luck.